The bovine reproductive cycle and all the hormones involved and how they interact with one another is something which is really important to know if you want to be a farm vet. It's something that's fairly complicated. There's a lot of different interactions, and something that I struggled to learn initially when I was at university, I think, because I was shown pictures like this of the hypothalamic pituitary gonadal axis and pictures like this of the entire cycle with all the structures all superimposed over one another with no colour, which made it quite hard to initially understand what was going on, and sometimes you didn't even know where to start because there was so much happening. So what I've tried to do is make it a little bit easier to look at. So I've colour-coded everything, all the different hormones. There's no way to make the hypothalamo-pituitary gonadal axis much simpler, but hopefully it's a bit easier to look at. And what we're going to do is we're going to go through each hormone individually and superimpose them on top of one another. So by the end, hopefully that graph you initially looked at will make a little bit more sense. So if we start with ovulation, so dominant follicle ovulates, the crater left where it used to be will become something called a corpus hemorrhagicum, which will then turn into a corpus luteum, which will then eventually turn into a corpus albicans. That all sounds very technical, but corpus hemorrhagicum is Latin for bloody body. Corpus luteum is Latin for yellow body, because when you cut them open, they look yellow. And corpus albicans is Latin for white body. So if you want something to sound very clever and technical, name it something really simple and say it in Latin, and it'll sound very clever. The CL produces progesterone. So it will ramp up once ovulation occurs, and about day 3 to 5 it will be at its peak, and it will just plateau until it eventually lutealizes. As we can see, the progesterone has a positive feedback on the uterus, which means eventually the endometrium of the uterus will produce prostaglandin F2 alpha. And what prostaglandin F2 alpha does is it stimulates luteolysis of that CL. So that CL will undergo apoptosis and die off, and that is what stops the progesterone from being produced. The other thing that we can see that progesterone does is it has a negative feedback on the hypothalamus. The hypothalamus is responsible for producing GnRH, and it will either produce it in infrequent pulses or frequent pulses based on the feedback it's receiving. So under progesterone, you will get infrequent pulses, which will stimulate the release of FSH. FSH is follicle stimulating hormone, so as you can imagine, it stimulates follicles. What we will see under progesterone is initially a massive group of follicles will be selected to differentiate. They will grow in size until one will eventually be selected as a dominant follicle. Whilst still under progesterone, however, that negative feedback will stop an LH surge from occurring, which means that dominant follicle will eventually die off, and you'll get a second wave forming. And as the second wave progresses, you'll get that luteolysis from the prostaglandin, which will reduce the progesterone in the environment and allow that dominant follicle to ovulate. So once the luteolysis starts occurring, the progesterone levels fall, and as we can see from the graph, that negative feedback gets removed. At the same time, the dominant follicle itself will start to produce estrogen. Estrogen has a positive feedback on both the hypothalamus and the anterior pituitary gland, which means that the GnRH releases will be more frequent, and the anterior pituitary itself will start producing more and more LH. This will eventually reach a peak, which will cause ovulation of that dominant follicle. An important thing to remember that progesterone does is it will prime a dominant follicle with LH receptors. That will mean that it's able to ovulate. The other hormone that we need to understand a bit more about is estrogen. So estrogen is not only responsible for that positive feedback, but it's responsible for all of the physical bulling signs that you would see in a cow. So bulling string, increased tone of the uterus, and all of the behavioural signs, so head pressing, head mounting, riding other cows. So if we put this entire thing together, hopefully that graph now makes a little bit more sense to you. In terms of the practical application of these hormones, when we actually go out on farm, there are three main hormones that we have control over. And those three are GnRH, prostaglandin F2 alpha, and progesterone. There are lots of different products that will be different based on what practice you go for, so I'm just going to stick to the hormone name rather than the product name. So GnRH, the one that we have available to us, when you inject that into the cow, the only thing it does is it causes an LH surge. It has no effect on FSH production whatsoever. That is because it's essentially overwhelming the system and causing a massive spike in GnRH, which just releases lots of LH all at once. So you can essentially look at GnRH as LH. The second drug that we have is prostaglandin F2 alpha. This causes the luteolysis of the CL, as we've previously discussed. And the third one we have is progesterone, which essentially acts as a synthetic CL. So you'll have progesterone releasing devices, which you put in usually into the cow's vagina, which will release a steady amount of progesterone into the bloodstream for whatever the product specific time is. Usually it's about 10 to 14 days. Now, when you actually go out on farm, the first thing you really need to do is understand what the farmer's talking about. So there's three different scenarios that cows are going to be presented to you for on routine. One is the cow that has not shown normal estrus behaviour in the normal time, which would be 21 to 23 days. So typically they'd be presented to you about day 30, having not had a heat. Farmers call these NSBs, or not seen bulling. They call them non-bullers. They call them no heats. They say that they're quiet, or they say they're not cycling. The second one we get shown is cows that need scanning for pregnancy. This can be called a PD, a preg check, a fertility check, or some farmers just say scan. And then the third animal is ones that we're going to be presented that we need to essentially check aren't in calf, because they're going to be sent to the slaughterhouse and you don't want the pregnancy to be there when they are. These are called barren cows, or the Americanism would be DNB, which stands for do not breed. They'd be called cull cows. Some farmers like to call them burgers. In terms of actually practically scanning these animals, this is what a CL looks like. So it's grey and solid and doesn't usually give when you press on it. This is what it looks like on an ultrasound. The general accepted size for it to be functional is over 20 millimeters. But actually, there have been a lot of studies now that have found that CLs smaller than that can produce enough progesterone, and CLs much larger than that cannot. So size is generally not really much of an indicator. The functional limit that we say is a functional CL is greater than 3 nanograms per mil of progesterone in the blood. But you're not going to be able to do that when you're scanning the cow. You just have to assume that CL is functional. Another thing to note about CLs is sometimes they will have a pocket of clear fluid in the center. That's called a lacuna, and it's totally normal. Doesn't seem to affect the productiveness of the CL whatsoever. You can also sometimes see more than one CL on the same ovary. This is something you need to warn the farmer about, because it means the cow is much more likely to have twins. They're often genetically predisposed to it. And just an interesting thing on this image is there's a blood artifact in the center of that CL on the right. Again, that is totally normal. Another thing you can see is a wave of follicles. This is what it would look like on an ultrasound. So the size of a follicle, the diameter of a follicle, in order for it to be potentially dominant, needs to be greater than 8 millimeters. The way you actually measure these structures is most scanners that you'll use will have 1 centimeter grids on the screen, just as in this image. So you can get a rough estimate of diameter by sizing it up on the squares, essentially. So a follicle greater than 8 millimeters is potentially dominant. So you need to put the entire picture in context for each animal. So you need to think about what the cow's been presented to you for. Is it not served but hasn't had a heat in an adequate amount of time? What have you seen on both ovaries? has the cow had any treatment so far? What does the farmer want to do with her? So does he want to get her pregnant? Does he want to make sure she's not pregnant? And then are there any underlying or concurrent health issues, things that are happening at the same time? So does she have mastitis? Is she lame? These might affect your choices, whether you want to undergo a sync or a treatment if you think that there might be other things holding her back. So if we put this in context, you've scanned this cow. All of these examples are going to be non-bulling cows, so they haven't had a normal length of estrus cycle. And on one ovary, you see a small wave of follicles, and on the other ovary, you see a CL. You can safely assume that it is in the new wave phase of its cycle. So it's not at a point where a dominant follicle has been selected yet. So it's either quite early on in its cycle or it's about in the middle. If you want to bring this animal back into estrus as quickly as possible, what you would do is you would treat it with prostaglandin F2 alpha to lutealize that CL. And you would say that because there is no follicle greater than 8 millimeters there, the likelihood is this animal will have a heat in 3 to 5 days. An important thing to note with prostaglandin F2 alpha is it actually will not work on a CL if they are less than 5 days old. So sometimes this treatment won't work if they're right at the very start of their cycle, because the CL has not existed long enough to have receptors for the PGF2 alpha yet. If you scan a cow and they have a follicle big enough to be a dominant follicle and a CL, they're going to be either at that end of the first wave stage where they have a dominant follicle but it's still under progesterone, or they are going to be right at the end and that CL may be undergoing luteolysis. There will be no way to tell looking at it under an ultrasound. In this case, you give prostaglandin F2 alpha again, but because they're a little bit further on in the wave, you can say that they will have a heat between 1 and 3 days from the injection. If you see a CL but no other structures, this is either right at the point where the first dominant follicle has just died off, or you are at a point where ovulation has just occurred and you may have missed it. Usually this would be accompanied by bulling tone or other signs. But if not, you can either give it prostaglandin and get rid of that CL, or you can simply wait for the next cycle because you feel like you may have missed the end of that heat. If you see just a follicle that is greater than 8 mil, so it's potentially dominant, but no other structures, this has to be a point at which the CL has completely died off, but the dominant follicle has not yet ovulated, in which case you can give a shot of GnRH and tell the farmer to serve her 16 hours after the treatment. And if you see no structures on either ovary, this can be no point in the normal estrus cycle. So we have to undergo a progesterone-based synchronization protocol. There are lots of different ones. It will be fairly practice-specific, but the important thing is you need to make sure that whatever sync you use, it has to have progesterone involved in it. And then I've included this as sort of a cheat sheet. So if you want to go through routines, not really understanding the cycle, but want to know what correct drug to use at what correct time, an overall rule is if there is a CL present, it's more important than all the other structures. So if there is a CL present, the quickest treatment to resume cyclicity would be prostaglandin F2 alpha to get rid of that CL and start again. If the only structure present is a follicle greater than 8 millimeter diameter and the cow has shown estrus signs, so you believe LH receptors are present on that follicle, you can give GnRH. And then if there's nothing on any ovary, then the only thing that you can do would be a progesterone-based synchronization protocol. One other thing to cover is cysts. So the two most important cysts really are true follicular cysts, which would look like this. They typically have a big diameter of 30 to 50 mil. And the important sign that you need to look for is that the cow is showing frequent bullings at very short intervals, so 2 to 6 day intervals, and repeatedly doing so. And you also have luteal cysts, which are essentially just CLs which have been there for too long. So follicular cysts, if they are causing frequent bulling signs, it means that they are producing estrogen. So there is a chance that the follicle that has stayed there too long, actually has LH receptors, but for whatever reason, the cow wasn't able to produce enough LH to get it to ovulate. So you can either give a double dose of GnRH in the hopes that the LH surge will cause that cystic structure to ovulate, or you could put a progesterone-based sink in, because the progesterone will prime the follicle with LH receptors, and then when you pull that progesterone-based product out, you will get the LH surge that will cause the ovulation. If there is a CL present alongside a large follicular structure, it cannot possibly be significant, so you can just ignore it and treat it as a normal structure because the CL takes priority. The other cystic structure is a luteal cyst, which is essentially just a CL which has been present for more than 14 days. It's hard to definitively diagnose without going back and remembering exactly what it looked like the last time, but they are normally responsive to PGF2 alpha the same as a regular CL, so you just essentially treat them like a regular CL. So hopefully both of these graphs make a bit more sense to you now, and you have a bit more of an understanding of how the hormones interact with one another. Congratulations on getting all the way through this video if you did.